Right. Well, the Idaho Health Data Exchange is a 501c6 not-for-profit corporation, and we are the state-designated entity for the receipt of the funding under Section 3013 of ARRA. So we are that entity. In terms of what the Idaho Health Data Exchange is doing, is it is creating a statewide health information exchange infrastructure to allow connection of hospitals, labs, care providers, so that they can communicate with each other to better coordinate and collaborate to improve quality of care. So practically what that means is that we do have your basic statewide HIE infrastructure, which includes a master patient index and a record locator service and a provider directory. We have 5 hospitals connected, and they're delivering results through our health information exchange, structured lab results, radiology, and transcribed reports. We also have 3 labs connected, and we hopefully in the next 120 days or so, we should be bringing up another 4 hospitals and an additional reference lab. So we do have about 100 users. The majority of those users are in practices. We also have something called a virtual health record. So in addition to delivery of lab results that are ordered by providers, we also provide a virtual clinical data repository. In that, data that's pushed through the exchange can be queried upon by participating providers. So for a specialty provider, that can be very useful in that if I'm seeing somebody at Idaho Gastroenterology, then their medical records folks can go in and find the results of tests that were ordered by other providers and then use that in providing care to me. Our virtual health record also provides a medication history query that will bring back medication history for patients who are on Blue Cross, Regents Blue Shield, or Medicaid. We are pretty active in coordination and collaboration with the Washington Idaho Regional Extension Center. That is the lead organization there is Qualis Health. And we are one of the consortium partners, so that we participate in calls and meetings with the Regional Extension Center. And certainly going forward, any presentations or interactions that I have, I'll be sharing information about the REC and the availability of those services. And I'm also working with them so that they have enough information, good information about the Health Information Exchange to share with their providers. We are also partnering with YREC and our Health Information Technology Coordinator to develop an Idaho provider advisory panel, because one of the things, even in a state as small as Idaho, you really do need to coordinate that communication. And what's clear is that providers get a lot of information from a lot of different sources, and it can be bewildering. I mean, they're trying to run a business, take care of patients, and to have this layered on top makes it very confusing. And if they hear different messages from different sources, it creates quite a cognitive load, if you will. And so our goal with the advisory panel is to coordinate our communication and also bring stakeholders to the table like the Idaho Medical Association, the tribes, the Hospital Association, all interested stakeholders, so that we're sharing information in a common forum and that we can get some recommendations around communications. The panel also includes Medicaid. So I think we do a pretty darn good job of coordinating in Idaho, because it is a small state. So essentially, folks know each other. Well, essentially, our initial model for funding the Health Information Exchange was participation fees. And so I think that at this point we're undergoing some analysis of that business plan to determine the continuing viability. But I think the idea makes sense, that those who use the Health Information Exchange should pay for the services. Now, who pays and how much? is an open question. I'm also intrigued by some of the models that I see coming out of other states, like Rhode Island, I think, has some sort of public utility model. I think that's an interesting avenue to explore, and it'll be interesting to watch that develop. And certainly we're happy to learn from other folks' experiences. I think the major challenge is the resource demands that managing all of those across the 5 domains bring. Certainly, given the maturity of our organization, we did have the governance structure worked out and those types of things. But the continual flow of regulations, both proposed and interim final rules, places a policy burden on each individual organization to analyze and determine the steps forward. So I think for me, it's really a resource issue to make sure that we have the necessary staffing to cover all of those bases. I also think that, well, the funding for the incentive programs gave us a little bit of a boost in terms of people being interested in what we're doing. I also think that it's created quite a bit of sound and noise. I talked earlier about providers being inundated with information, and there's so much information and there's such an urgency about making decisions that I think some people just stop. And they don't want to make a mistake, so they may not make a decision at all. And so I think part of the challenge is getting folks past the fear barrier about, making the wrong choice, picking the wrong path, and then having to redirect. Well, it sounds like our strategy is going to be somewhat similar to New York's in that we do want to be very active in engaging consumers. We do have on our agenda a slate of consumer meetings working on development of avenues for communication with consumers, including social media and those types of things. So we do have a very specific plan to engage patients, because I think what's interesting for me is periodically I'll get unsolicited feedback from patients who call up and say, "This is a great idea. Whose idea was this? This is fabulous." Or, somebody wanting to push it yet a little bit further. And so I think that engaging consumers can help us continue to be successful. So it is certainly part of our plans, and plans that will be implemented once our operational plan is approved by ONC.